Welcome to this explainer. If you've ever been scheduled for a CT scan or an MRI, you've probably run into a little bit of mystery regarding the exact details of the procedure. So today, we're demystifying this whole process. We'll be using insights from medical radiographer and radiation safety advocate Rad Kelvin Luntzi to break down exactly what happens and, crucially, why some radiology examinations require contrast media in the first place.
Okay, let's dive right into this. The single most common question patients ask before going into a CT scan or MRI is, wait, will I be given an injection? And is it actually safe? Honestly, it's completely natural to want to know exactly what's going into your body. So today, we're looking at the medical facts to answer both parts of that question clearly and simply.
Section 1. What is contrast media? Demystifying the dye.
So, when you hear the term contrast media, which, by the way, is often just called contrast dye by patients and medical staff alike, it refers to a special substance designed to help doctors see certain parts of your body way more clearly during imaging tests. Now, to be clear, it's not a treatment, and it doesn't cure anything on its own. Instead, think of it almost like a high-tech highlighter for your insides. It reveals all those tiny details that would otherwise just remain hidden in the shadows. Moving on to Section 2. Why we need it, giving doctors superpowers.
What's really interesting here is how this single tool acts like a brilliant spotlight for your medical team. It makes blood vessels, organs, and certain diseases highly visible on medical images. It is absolutely critical for things like detecting tumors, identifying infections, examining blood vessels, looking for internal bleeding, and evaluating kidney and liver conditions. By using this special substance, the structures in your body stand out in sharp contrast against the surrounding tissue. It basically allows doctors to spot these specific, critical health conditions with incredible precision.
And that brings us to a fundamental truth about why some radiology examinations strictly require this step. The injection isn't just arbitrary. It directly improves the accuracy of the diagnosis. Literally, that is the exact reason your healthcare provider ordered it. They aren't just taking pictures for the fun of it. They need a highly precise, accurate map of what is actually going on inside your body. The contrast dye provides that clarity, ensuring they can give you the absolute best medical care based on a correct diagnosis. But hey, knowing why it's done doesn't totally erase the worry about how it affects you, right? So we really need to talk about safety.
Section 3. Is it actually safe? What you need to know.
So the crucial point is it safe? Well, for the vast majority of people, the answer is a resounding yes. Contrast media are generally very safe. But as we all know, medicine is rarely a one-size-fits-all situation. There are specific exceptions where your healthcare provider needs to exercise some extra caution, and that is exactly why they ask you a series of screening questions before the procedure even begins.
Here are the 4 specific conditions your doctor or radiographer will be carefully screening for. They might ask about, and you absolutely must report, any previous allergic reactions to contrast, any history of kidney disease, if you are currently pregnant, or if you are taking certain medications. You should always inform your radiographer or doctor about your medical history before the exam. Sharing this info, it isn't just routine paperwork. It is a vital, totally non-negotiable step to make sure the contrast dye is used safely and effectively for your unique medical profile.
Now, it's also highly important to remember this really reassuring fact. Not every single CT scan or MRI requires contrast. Your doctor only requests this step when that additional information is absolutely needed to make the best diagnosis possible. If they can get the answers they need from a standard scan without the dye, believe me, they will. It's a specialized tool reserved for when it truly matters.
Section 4. Seeing the unseen. The life-saving power of imaging. Taking a step back to look at the big picture, Rad Kelvin Luntzi puts it perfectly. He says, medical imaging saves lives by helping doctors see what cannot be seen from the outside. And this brilliantly illustrates why all of this matters so much. The contrast media we've been discussing today isn't just some boring clinical substance. It's literally the key that unlocks that life-saving vision. It allows medical professionals to look beneath the surface and ultimately save lives.
To wrap up this explainer, I want to turn it over to you. Have you ever had a contrast-enhanced CT scan or MRI? I want you to think about your own experiences, and if you have questions or stories, share them. It really helps demystify these procedures for everyone else. Thank you so much for joining me today. I hope this cleared up the mystery for you, and I will see you in the next explainer.